Good afternoon. I'm Ken Gordon. I'm representing the Area Agencies on Aging. Thanks for the opportunity to testify today, for your service to the state, and for shouldering this difficult responsibility of managing multiple needs. The administration's budget proposal includes cuts to 3 important programs for older adults and people with disabilities living in the community. The first is a cut of approximately $34,000 for the Elder Care Clinician Program, a service that provides mental health outreach to older Vermonters in their homes. The second is a cut of $200,000 for the Area Agencies on Aging. It will lead to cuts in the Meals on Wheels program, other important services, including caregiver respite, transportation, case management, and wellness programs. Lastly, there's a cut of roughly $2 million to state general funds, an additional $3 million in lost federal funding for the Choices for Care program. What's both significant and consistent about these cuts is that all 3 programs and cuts will make it more difficult for frail seniors and people with disabilities to remain at home, and some percentage of these individuals will end up in nursing home care. Each person that requires nursing home care costs the state roughly $30,000 to $40,000 per year. 10 people equals $300,000, 50 equals $1.5 million. The administration is correct to focus on home and community-based services, but they do get it wrong. We need to expand home and community-based services in order to save more money, not retract them. It's also important to note that the bill budget does include an increase for nursing homes. We believe that nursing homes clearly need the resources to provide excellent care. We shouldn't do that at the expense of cuts to home and community-based services. Essentially, by increasing the investment in institutional care while reducing its commitment to home and community-based services, the state's subsidizing more expensive and less desirable form of care.
Good afternoon. I'm Kelly Stoddard with the American Cancer Society, Vice President of Health and Advocacy Initiatives. We'll be testifying on 2 proposed budget cuts, one in regards to folding Catamount into VHAP, and then also the proposed cuts to the state tobacco control program. There's certainly some significant benefits to rolling Catamount into VHAP. One is the elimination of the pre-existing conditions clause, and then also reduction in the coinsurance. 2 issues of concern that we do have is, one is the increase in the deductible, which would place undue burden on cancer patients for out-of-pocket costs. Facing cancer is extremely difficult financially. Many individuals have significant out-of-pocket costs when diagnosed with cancer. A recent study that we did was we found that 1 in 9 cancer patients' out-of-pocket costs exceeded 20% of their family's income. The median average out-of-pocket cost for a breast cancer patient is around $2,600. 5% of those patients was over $31,000. Majority of enrollees in Catamount are between 150 to 200% of the federal poverty level. So more than doubling the deductible from $500 to $1,200 would place significant financial burden on those individuals. Also, our other concern is in regards to reimbursements for doctors and how that would impact specialty care for cancer patients, and also if you had to go out of network, for instance, for clinical trials, etc. Second issue I'd like to address is the proposed $2.1 million cut to the tobacco control program. This program saves lives and saves the state $4 to $5 million in Medicaid costs alone each year. The cut would devastate counter-marketing and advertising that would drive folks to the program, but also eliminate cessation services across the state. Thanks. I do have a copy of my testimony with further information, so thank you.
Thank you. Nicole, please. Good afternoon. I'm Nicole
Lucas with the American Heart Association, Director of Public Health and Advocacy. I wanted to talk today about the Tobacco Trust Fund. Protecting the trust fund. The trust fund was designed as a long-term way to assure the sustainability of tobacco control programs. And as we know, demands on the master settlement dollars and the trust fund have put both it and the program at risk. Given that the trust fund balance is now at an all-time low, I think right around 14 million, and MSA dollars are likely to continue to decrease, we're really urging the legislature to rethink the current use of MSA funding, or there will soon be no trust fund monies left, and the future of the tobacco program will be in jeopardy. If money is to be taken from the trust fund, it makes sense to use it to prevent cuts to the tobacco control program, since the trust fund was established to ensure the program could operate successfully for many years. So we're extremely concerned about further money being taken from this fund, and we really urge you to, if any of those funds are going to be used, to fund the cuts to the tobacco control program. And then finally, I also wanted to let the committee know that the American Heart Association and the Coalition for Tobacco-Free Vermont are supporting a $1 increase to the cigarette excise tax this year. We know this is a way to stop youth from ever starting to smoke. We know that it helps adults quit. It'll save Vermont healthcare dollars, and it'll also raise $10.2 million in revenues, a figure that we has been confirmed by JFO as an accurate projection. Thanks a lot.
The recent plan for healthcare reform in Vermont includes rolling the Catamount Health Plan into BHAP, raises concerns due to the minimum coverage for chiropractic service in the BHAP plan. The only chiropractic service BHAP covers is spinal manipulation. It does not cover the full scope of practice for chiropractic in Vermont. Full scope of practice includes examinations, physical medicine, rehabilitation, treatment of any extremities or muscular conditions, plus working with the patient on modifying their activities of daily living, which often cause the injury in the first place. One of the major concerns with healthcare is cost containment. A recent study performed by Blue Cross Blue Shield of Tennessee found that total cost for the treatment of low back pain was reduced by 40% if treatment of that episode was initiated by a chiropractor with full scope of practice versus a medical doctor, MD, or osteopath. A 4-year study of Blue Cross Illinois found savings of 40-50% for hospital admissions, pharmaceutical costs, outpatient surgeries for patients using full scope DCs as their primary provider of musculoskeletal conditions. There are many other studies of this type. Chiropractors concur with written comments by the Vermont Medical Society that proposed rehab switch is inconsistent with the governor's health care, putting Medicaid patients' access to care at risk, citing Section 18 VSA Section 9375 sub A of H202, and I quote, "It is the intent of the General Assembly to ensure reasonable payments to healthcare professionals and to eliminate the shift of costs between payers and health services by ensuring that the amount paid to healthcare professionals is sufficient and distributed equitably. Expanding enrollment in Medicaid with this below-cost physician reimbursement will put physicians' ability to provide care to their patients at risk and add to the cost shift. Likewise for doctors and chiropractor." And if I can make it to that, I think I might be at that. Thank
Good afternoon. My name is Sheila Reed. I'm with Voices for Vermont's Children. I'd like to make a few comments about the Department of Children and Families budget today. The first thing is Voices supports the re-examination of the redesign of the child care eligibility system. We strongly support what Commissioner Iacomoni said to this committee, that he has a preference for leaving child care eligibility workers in the community rather than making them part of the centralized intake system in Waterbury. We believe that further data will show that it is far more benefit to having the positions where the caseworker can develop a relationship with applicants. We strongly support the hiring of 18 additional social workers for the Family Service Division. At the present time, the ratio of worker to client is 19:1. This does not meet best practices or the statute that was passed by this legislature 2 years ago. And even with 18 new social workers, the ratio will be 1 to 15, not 1 to 12, which is best practices. We're deeply concerned about the cuts in the residential care budget. The last 2 years, the residential care system has had significant cuts in the name of reduction of beds and reduction of need. At this point, we feel that system is very vulnerable, and we would ask no more cuts to beds in the residential care system. We do not support the recoupment of state-funded reach-up programs from our benefits from retroactive SSI awards. And we go with the legal aid position on that. You'll hear more from Christopher Curtis tomorrow. And we also support the continuation of listed specialty grants and ask that you consider putting those grants into the base, and you'll hear from those people also. Thank you.
Michael Sutton.
Madam Chair, Michael Sorokin, on behalf of the community of Vermont Elders. I'd like to make 3 points in the brief time I have here today. I want to talk about the choices for care cuts, the $2.1 million in general fund cuts. We think there is a misperception out there as to who the people that are going to lose benefits under these particular proposals are. We think there's a miscalculation in the savings, and we think there's a misdirection in the overall program for choices of care that's represented by these cuts. The misperception of who these folks are, when we talk about the services that are being cut, we talk about housekeeping, meal preparation, snow shoveling, grocery shopping, and help with medication management. That doesn't tell the full picture. Virtually every single person on this program who are getting those services proposed to be cut have total problems with at least one activity of daily living, such as bathing, eating, feeding, or toileting. So even though these are the services around the basic services, we're talking about the frailest of our Vermont residents. On the miscalculation of savings that I want to talk about, the administration admits that in addition to the savings they project here, they have made no calculation for the potential that even one of the 1,500 people who may be cut under this program may wind up in an enhanced residential care facility or in a nursing home. And we've been trying to get these numbers, and what we have done at this point is take a very unscientific study of the people in the community who work with these people on a day-to-day basis. That is the case managers that work with the area agencies on aging. And what we found was that of the 250 people in the Champlain Valley Area Agency on Aging, they project 62 to 102 people will wind up in institutional care. In Central Vermont, of 120, 30 to 40. Of the Southwest Council on Aging, of about 173, 50 to 71 people would wind up. And in Southeast and Northeast, they predict 25 to 30 out of their 120 cases each would wind up. If you figure in that, time's up. Okay, thank you. I think the savings will be essentially wiped out if those projections of the caseworkers prove to be true. We'll follow up with more information on that 2 years later. Thank you.
Thank you.